Hey guys, so I am making this video for the second time. I just recorded it and realized I was on Fort Worth ISD's internet, and every time I do that, it cuts like every other word that I say off. So I was so frustrated. Anyway, I was like, no, I have to do it again. But hopefully that means like I do it even better this time. I don't know. So I'm gonna be going over chapter five, chapter five of the DHO book. And let's see, it is on legal and ethics. So it's a little bit boring, I'm not gonna lie, but I think I kind of make it interesting. I've got some stories, some interesting stories to tell about that. So, okay, I'm going to share my screen and then begin here. Let's see. Present, yeah, present my screen. Okay. And hopefully, it's kind of a long lecture, but I actually shortened it to like 13 minutes, so it wasn't that long. Once I actually did it, I thought it was because there was a lot of slides, but I kind of go through them pretty quick. I just hit the highlights, you guys. Hit the highlights. Okay, so play from current slide. Yeah. All right, so we're going to talk about legal and ethical responsibilities in healthcare. And it just kind of encompasses a lot, actually. So, laws and legal responsibilities protect you and a society as a whole. Criminal law is are wrongs against a person, property, or society, but civil law is relationships between people and protection of a person's rights. That's civil law. Torts are a wrongful act that does not involve a contract. And then here's just some examples, and these are key terms in the book: malpractice, negligence, assault and battery, invasion of privacy. And you can look all of those up. You'll be doing uh, key terms in this chapter. Here's some more: false imprisonment, abuse, defamation. And then, so we're going to get into contracts. So contracts are important in healthcare, and they kind of encompass a lot of different things. So in a contract, you usually have an offer, and then there's consideration and then acceptance of the offer. Sometimes it's implied and sometimes it's expressed. So implied means that you've talked about it and it's been or not, sometimes not even talked about it. Like, for example, if you go to the dentist and you want to get your teeth cleaned, well, it's implied that you're getting your teeth cleaned. So they just take you back there, set you down, and like start cleaning your teeth, right? But that's not always the case, because say you go to the dentist and you're getting like work done, like you're getting teeth fillings done or a crown or something like that, because you have cavities, they're usually going to have you sign a form saying this is how much it's going to be. Do you authorize us to drill through your teeth and get you numb and all those things? And so that's going to be an expressed contract, because you're going to have signed something concrete saying, hey, yeah, I do allow you to do this. But implied is just literally you've talked about it, or you are showing some way that you are saying yes to this thing that you're doing in the healthcare setting. Okay, so contracted parties must be free of legal disability. Breach of contract, we're not going to go through all of these, actually. You just kind of need to know what a contract is, and implied and expressed. Okay, so privileged communications. All information from a patient must be kept confidential. And so it can only be released with a patient's written consent. And healthcare records are privileged. So the Health Insurance Portability and Accountability Act, or HIPAA, of 1996, actually started standards for privacy practices. And so this caused a lot of things to change, because you started having to sign consent forms. You started having to, if you went to the doctor and you were like married to somebody, you had to put your spouse or even like your family members, whoever, on your HIPAA form if you wanted them to have any information regarding your care. So if they called up there and asked a question about your care or something, even like how much something was, how much something costs, whatever, they couldn't the after this was pushed through, you couldn't get any information unless you were on the HIPAA form, the patient's HIPAA form. So this, but I will say, if you're under 18, your parent or guardian already has the rights to your health information. So you have to be 18 or older to have private information away from your parents. That's not to say that anyone can get your information. I'm just saying your parents have that right, unless you're emancipated, I guess. Okay, Privacy Act, written authorization for release of information. Okay, then we're going to talk about scope of practice. So in healthcare, every provider has what's called a scope of practice. So it's basically what you can do legally in your job. And that goes for doctors, that goes for nurses, whoever you are. When I was a dental hygienist, I could clean teeth, right? But I couldn't, it would be out of my scope of practice to do a filling on a patient. Or in Texas, you're not allowed to do, what's it called? You can't get someone numb. You can't do like anesthesia of any kind as a hygienist. So that's out of my scope of practice. That would be illegal. And so in my scope of practice, I'm only allowed to do what I'm allowed to do, right? That's with every healthcare profession. And then we talk about ethics. So ethics are a set of principles dealing with what's morally right and wrong. It provides a standard of conduct or code of behavior and helps healthcare workers analyze information and make appropriate decisions. There's a lot of ethical dilemmas that go on in healthcare. So things like euthanasia, confidentiality of AIDS diagnosis, use of aborted fetuses in research, continuing life support, expensive treatments and payment. All of these are something to think about. For example, continuing life support, I hear about that a lot, actually. There was some stuff on the news recently. It's been going on like the past year. There's like a little girl over at Cook's that is like 1 or 2 years old and is kind of on life support. And Cook's is saying that it's not ethical to keep her alive anymore. But her mom like was refusing to stop treatment. But there's just like so much red tape in between. So it's like there's just a lot of, what's ethical and what's not. Like it's a gray area, you know what I mean? And so it's, some people would say, well, it's up to the, to the parent or guardian or family to decide what they want for their family. And other people say, well, the healthcare workers shouldn't have to be, shouldn't have to do things they feel are unethical, because some healthcare workers think it's unethical to keep somebody alive who is suffering like they are. And so it's like it's hard. It's hard. There's no defined answers. And sometimes they do go to court. And here's some others: transplant decisions, legal issues with medical marijuana use, animals in research, genetic research, cloning, and stem cell research. Some basic principles of ethics are in healthcare: to save lives and promote health, to protect patient comfort, respect a patient's right to die peacefully and with dignity, to treat all patients equally and provide the best care possible for our patients. Some basic principles, again, maintaining competent skills and knowledge, staying up to date with your continuing education, respect rules of confidentiality, and refrain from immoral, unethical, or illegal practices. Some more basic principles showing loyalty to patients, being sincere, honest, and caring. Learn and abide by the code of ethics for your chosen career, because each chosen career is going to have a set of ethics. This kind of came up actually recently with social workers, which I don't think that they are considered healthcare workers, but this still kind of applied to them. There was something that went through or passed saying that they could deny treating someone or helping someone based on their LGBTQ status, or like their genders, or I think it was like, or what was it? Disability, or their like sexual preference or something like that. It was crazy. And I had a bunch of friends of mine who are social workers, and they were like, this is against our code of ethics. Like, no social worker is gonna like abide by this, like, or do this, because it's out of our code of ethics. Like when you go into that career, you're saying, I'm going to treat everybody the same. I'm going to treat everybody regardless and help everybody regardless of, their gender, their race, their ethnicity, their disability, whatever it is. Like I'm going to take care of them. And if you don't want to go in, if you have a problem with that, like you shouldn't go into that career, So if you have a problem with any of those things because I think it's pretty much spans over the course of, doctors, nurses, all of those things, you have to be willing to treat whoever, regardless of, some of these things that you may disagree with in their life. So that is important. And that's just one example there for you. Patients' rights. Let's see. Agencies must have written policies for patients' rights. So now there are patient rights that like patients have that the Department of Health and Human Services have implemented. And it's called the Consumer Bill of Rights and Responsibilities, especially in the long-term care facilities because they live there. They have rights guaranteed under OBRA 90, which was a act that is that basically said, long-term care facilities must have a residence bill of rights and follow it. Okay, and then the Patient Protection and Affordable Care Act guarantees rights related to healthcare coverage. This goes along with Obamacare. There's coverage of essential health benefits, preventative care, coverage of pre-existing conditions, coverage up to age 26 on parents' plan. Oops, sorry. And then there's just some other things that came along with that. So there were some really good stuff that came from Obamacare. I'm kind of really in the middle on Obamacare because, Obamacare actually did create basically a way for everybody to get health care, but it also made healthcare a lot more expensive because the insurance companies all of a sudden had to start upping deductibles and premiums to basically pay for all these other people coming on board that were that had existing conditions and stuff like that. So my insurance went up significantly over the last 10 years because of Obamacare. So but there were good things. I mean, I stayed on my parents' insurance till I was 26 because of I think at the time I was still in. I got a job, but my dental hygiene job didn't have insurance. So I was able to just stay on my parents' insurance, and it was way cheaper then. So there's been positive negatives to that. But as far as patient rights go, there were rights such as they can't deny you coverage based on pre-existing conditions in the Affordable Care Act. Okay, let's go to advanced directives. So advanced directives are interesting. These are known as legal directives. They're a legal document. And there's two different kinds. There's a living will and a designation of healthcare surrogate or durable power of attorney. And these are the two main things. Now, there are also advanced directives like do not resuscitates. And I've got a story about that I'll tell you guys. I've got two stories, actually. So the first story was when I was in the hospital having my baby. They actually have you sign this thing. It's not only gives the durable power of attorney, which was my husband. Basically, he could make decisions for me if something were to happen and I was incapacitated and unable to make decisions for myself in the hospital. But it also, they said, do you want to be resuscitated? If you die, if your heart stops, you want to be resuscitated. So of course, I was like, yes, I want all of those things. But it was kind of freaky. They had me, doing this, right as I was about to go in to have a baby. But it was just in case I had a C-section or something happened where they had to put me under anesthesia. They wanted to have that just in case. We'll see if I've got. But another one was when my stepdad's father went into the hospital to have routine knee surgery, I want to say. His wife had died a few months before that. And this was probably 7 years ago. But he went in and they gave him a do not resuscitate form and said, do you want to be resuscitated, if something happens? And he said, no, I just want you guys to let me go. Like, don't want to be resuscitated. He made it pretty clear. And so they were like, okay, well, he was going in for routine surgery. You guys, he died on the table. His heart stopped, and the surgeon looked at the DNR and was like, we can't resuscitate him because this is the patient's legal directives for us. So he did die, and it was just weird that like his wife had died a few months prior. I think he just thought, hey, well, if it's time for me to go, it's time for me to go, but just crazy. So okay, professional standards. These are just things you would need to do professionally, like perform only the procedures for which you have been trained to do. I mean, these things are pretty common sense. Use approved methods, so you're not doing some random surgery that you've never done before that's not approved by the FDA. Obtain proper authorization before performing any procedures. Identify the patient, obtain patient consent, observe safety precautions, keep all information confidential, think before speaking. That's a good one. Consider what you say, treat all patients equally. All of those things are just professional standards. And some of these can be like, you could be sued if you don't do them. Do not accept tips or bribes. If an error or mistake is made, you need to report it to your supervisor. Behave professionally and dress, language, manners, and actions. This just talks about liability insurance. Like if you are a healthcare provider of any kind, probably you'll have insurance to protect you just in case something happens. If not, your employer might, or your employer might have liability insurance, and you would have to have your own insurance depending on what you do. And that is the end. So it didn't take that long to go through. I hope this is interesting to you guys. I'm gonna stop presenting here. And I hope you learned something. So yeah, I will talk to you guys later, and hope you have a great day. Bye.